50 million people in the world suffer from dementia, and that number is expected to treble in the next 30 years. But research also shows that as many as 4 out of 10 cases could be prevented or delayed by following simple things like healthy lifestyle, getting exercise, and eating properly, as well as staying mentally fit. Today is also World Alzheimer's Day, which is aimed at raising awareness of dementia as a brain syndrome that affects things like memory, thinking, behavior, and sometimes even emotion. It's particularly difficult for relatives to take care of loved ones who suffer from dementia. Our next guest, who is identifying through a pseudonym as Mary, lives with a relative who suffers from Alzheimer's disease. Also joining this conversation in just a while, we'll bring in Dr. Sihle Nhlabathi, who's a consultant psychiatrist at Skitland Hospital, as we talk about fighting the stigma and how families can best deal with dementia. To both of my guests, thanks very much for your time and welcome to the AM Report. Mary, joining us via the line, let me start with you. I mean, you have someone in close proximity to you living with dementia. That comes with its own challenges, and we'll get into that in just a moment. But as a start, I just wanted to get a sense of from you what initial signs you picked up that I guess made you realize that something is at play here.
Thank you, Ayanda. Actually, I think a couple of years ago, not even 5 years ago, when we started to see that our loved one with dementia was exhibiting rather out of character behavior. And at that point, we couldn't really place it what it was, although somewhere in my head I could, as time went on, I would tick off some boxes and do research and try to read on, because also from what she would be telling us about, ironically, she's well read in the topic, and it was something very close to her heart. And so because of that, I sort of like had an idea. But then it's not easy to think that your very close relative could just have dementia of any kind. So it was those small things that were just out of character, and would sit and think, I wonder, why would she do this? Why would she do that? For example, when she would think that we were at her place hosting a party, for example. She didn't sleep properly because we were there hosting a party. And we want to reason logically with her and explain that, but we weren't there. We're not anywhere near your house. So those were some small signs, and also misplacing things and so on. But those were small signs that we didn't necessarily take into cognizance at the time. But as time went on, then we started, because then they became more amplified, I would say.
Yeah. If you've just joined this conversation, Mary is using a pseudonym this morning because we're trying to protect the identity of the relative she's referring to. So, Mary, you also explained that, this relative actually was, ironically, for lack of a better term, well-read when it comes to Alzheimer's and dementia. But how much did you know about the condition before it was diagnosed?
We didn't know much. I didn't know much. She would sort of like start those informal conversations around the table way earlier, when she was still quite active and working and all that. But it wasn't anything formal, as I said. So I wouldn't say I knew much about it. It's just that, okay, I knew the term dementia, I knew Alzheimer's disease, and she did explain the difference between the two. And she would talk about how our elderly are treated, especially in our rural areas in our country. So that's basically it, really.
Right. And what's really difficult, Mary, is that we're learning more and more about this condition, and what's now emerged that, people who suffer from dementia and Alzheimer's can be very easily triggered by things around them. Even just a normal conversation taking place on their TV, for instance, could trigger them into an episode. Take me through the very day-to-day mundane challenges that you're facing.
Oh, that can be very challenging. I'm sorry, you'll find me sort of like laughing every once in a while. That's because in any case we have to find laughter, and humor in it. But it's very challenging. You'll find that on a day-to-day, you switch on the TV, and she'll be watching because she enjoys the news. She's always been that person. She reads, she watches news, she takes notes. So she'll be watching the news, and then, say, for example, the state capture comes on. At that point, oftentimes she will think when they refer to whoever's on the stand, she thinks they're referring to her. So it's very difficult at this point for her to differentiate between what's on TV and what's here in the real for her. So then it will be a thing of she has to now defend herself, then she gets agitated, then she's irritable for a period of time. Sometimes you find that in the morning when you wake up, we take the morning coffee and she's fine. But then when you take the medication, then it's a whole different mood, because we talk about someone who was actually in the health department. So now she'd be thinking, why are you giving me medication? What is this for? And so on. So that puts her off the mood, and it just becomes a thing of uncertainty. Every day, you never know. You just live by the hour and hoping that she'll be in a good mood the rest of the day. Otherwise, it's uncertainty.
Sure. Mary, thanks so much for helping us anchor this conversation. Truly appreciate your time and your willingness to be open to us about your experience. That of there is Mary, who's going with a pseudonym to try to protect the identity of the patients you're referring to. Mary, thanks very much indeed once again.